delayed period, that heavier than normal period, that period you're getting with severe cramp, pain, could just be a chemical pregnancy ending. So in this video, we're going to be looking at what is chemical pregnancy, the causes, and also signs and symptoms. So give this video a thumbs up as you watch. That is going to help you get more visibility. And for my returning subscribers, thank you so much for coming around. Please subscribe if you've not done so and hit the notification bell so you get updates when there's a new video. Now, a chemical pregnancy is a kind of miscarriage that happens within the first 5 weeks of pregnancy. Now, it is an early miscarriage, very early miscarriage, and sometimes the pregnant person would not even know that she was pregnant at all. All you know is that your period delayed a bit, your period was heavier than usual, you got cramps that was more than the usual cramp you used to have, and that is all you know. But trust me, it could just be a chemical pregnancy. This pregnancy ends so early that some persons do not know. Meanwhile, some actually find out they are pregnant, because your period have delayed for 2 days, 3 days. You decide to take a pregnancy test. Sometimes it might just be a faint positive, but you got a positive, and then the next day you are bleeding. That is the chemical pregnancy. What happens is that fertilization took place, normally implantation took place, but somehow the pregnancy did not develop, and then it just ends very, very early. That is what a chemical pregnancy is. Now, women will get chemical pregnancy and do not know that there was even pregnancy at all. Most times it go unnoticed because it ends so quickly. So you might be thinking maybe stress delayed your period and all that. Meanwhile, a pregnancy actually happened and then it's coming out. So we're going to be looking at some of the signs and symptoms of chemical pregnancy, and number 1 is heavier than normal period. If you discover that your period all of a sudden is so heavy, and then you're bleeding with clots, you're bleeding so much, feeling lots of tired, it could just be that it's a chemical pregnancy that has ended. A heavier than normal period in a cycle could be a sign of chemical pregnancy. Number 2 is cramp that is more severe than your normal menstrual cramp. Now, during miscarriage, you get lots of cramp, just like you get bleeding. So if you're getting cramp that is so severe, more than the normal cramp you used to get, or you're somebody who do not even get menstrual cramp, your menses just come, and then all of a sudden this month you're having very severe menstrual cramp along with your bleeding, then it could be that it is a chemical pregnancy that has just ended. So yeah, having a severe cramp that is unusual can be a sign of chemical pregnancy. Another one is low HCG level. Now, HCG is the human chorionic gonadotropin. It is a hormone that is picked on the pregnancy test, and it is a hormone that is found in the woman's bloodstream during pregnancy. Now, with chemical pregnancy, the hormone level is very low, and that is why some persons might not even know that they were pregnant until it just ends. So the next one is lack of pregnancy symptoms. So with chemical pregnancy, most times you might not get the pregnancy symptoms because, of course, it happens so quickly, and then the HCG level is low, so the signs and symptoms of pregnancy might just be absent. So chemical pregnancy is actually a very, very early kind of miscarriage. So women might have more than one chemical pregnancy go unnoticed, while some actually find out that, oh, they were pregnant right now, and then the next thing is they are bleeding, and that's a miscarriage already. So chemical pregnancy ends so early, so it is an early form of miscarriage that happened within the first 5 weeks of pregnancy. Now, some of the causes of chemical pregnancy is just like the causes of the normal miscarriages women have in the other weeks of pregnancies. Now, miscarriages most times do not have major causes that you say, okay, this is the reason I miscarried. But the main one is chromosomal abnormalities. Now, it is possible that the fertilized egg have abnormal chromosomes, and so the body tends to just reject the pregnancy, and then you begin to bleed, and that's the end of that pregnancy. So chromosomal abnormality is one of the leading cause of miscarriages for most women, and that is the same with chemical pregnancy. For people that use assisted reproductive techniques, it could be damage to the embryo during freezing. So if there was a damage to the embryo during freezing, it is going to result to a chemical pregnancy because it might not be able to stick after, during implantation. So these are some of the causes of chemical pregnancy. Now, chemical pregnancy does not mean that you have a problem as a woman. It does not mean that you are not fertile. It simply means that the normal reproductive processes are taking place. The fertilization is taking place, ovulation is taking place. There was also implantation, but the only thing is that the pregnancy could not continue, and this is due to most times chromosomal abnormalities, issues with the fertilized egg, or issues with the sperm that fertilized the egg. So take 1 tablet of folic acid on a daily basis. Now, folic acid, take 1 tablet of folic acid daily. A tablet of folic acid is equivalent to 400 micrograms. Just in case you're getting one that only comes, you just see 400 micrograms, it's still the same as 1 tablet. So make sure you're taking 1 tablet of folic acid on a daily basis. This is going to help in formation of healthy babies and also reduce the chances of chromosomal abnormalities. Number 2 thing that you should continue to do consistently is ensure that you maintain a healthy weight. Ensure that your weight is at the optimal level. Don't gain too much and don't lose too much. Just make sure you're maintaining a very healthy weight. Now, the next thing is to exercise regularly. Now, you need to have a consistent schedule of exercise. 3 times a week is perfect, but make sure it is consistent and it is regular. The next thing that you will do is to avoid smoking. Now, smoking is very detrimental to your health as well as your reproductive health. Reduce alcohol intake. If you're someone who is addicted to alcohol, who takes alcohol on a daily basis and in large quantity, please, it's time for you to reduce the quantity of alcohol you consume. The thing that you should do is to increase your vegetable and fruit intake. So chemical pregnancy actually points to the fact that you are fertile, and all you need to do is try again in the next cycle, and trust me, you might just have your baby in your hand. So thank you so much for watching this video. Kindly give the video a thumbs up if you've not done so, and please subscribe if you've also not done so. Hit the notification bell so you continue to get updates when there's a new video. Thank you all so much. I'll see you again in the next video. Bye.